Good afternoon, ladies and gentlemen, and I'd like to say at the outset, my name is Kevin James. I'm from Brisbane, Queensland, and I'd like to thank the Opus people for the excellent opportunity in being able to speak with you all today. I am a chronic pain patient. I suffer from osteoarthritis, facet disease, lumbar area, and I have 24/7 neuropathy or nerve pain. But what I'd like to do for the next 8 to 10 minutes initially is tell you a little bit about my condition and some of the barriers that I've encountered, and then I might present some statistics towards the end of the talk and a summary. But to start with, I'd like to say that I'm going to talk about my main barriers to receiving prompt, appropriate and effective care for osteoarthritis. And I have to go back to May 2009, which was when I was first misdiagnosed with lower back pain that was thought to be discogenic or of disc origin. As it turned out, a few years later, when I got a correct diagnosis, it seems that I've actually got facet disease, or the little bones, as we all know, that are adjacent to the discs, and they have compressed the nerves. But I'll go back to the beginning. When I was first aware of the back pain, I went to see a couple of surgeons. I went to see a neurosurgeon. I went to see an osteosurgeon, sorry, and they told me that there was nothing they could do for me. I wasn't even aware that a pain specialist was a profession 12 years ago, and it took a couple of years of research and looking online before I found out that I could see a pain specialist, and that's what I did. And over the next few years, from 2012 to 2015, I actually had 9 radio frequency treatments or nerve ablations, which were initially successful, but we stopped after number 9 because they were no longer effective. So for me, the most important thing at that time was actually learning exactly what's out there and how do I find it. So to move to my first barrier, I'd like to talk about patient knowledge. And for me, that was important. And I'm fortunate because I come from a registered nurse background, but many other people may struggle. What I've always said is knowledge is power. And that's what I say to the people in my pain support group. Another thing that was important for me is the fact that I have private health coverage, but not everybody has private health coverage. Some people only can go through the public system. I'm also fortunate that I came from a background where I had a full-time job. However, that stopped in 2015 when I could no longer mobilize effectively or get around. So I no longer had an income. In the last 5 years, I've been living off my own savings and recently on Centrelink. So not everybody has the money to afford private health or perhaps even go and do all the things we're meant to do with allied health, such as physio. But I'll get onto that in a moment. Another thing, which I'm lucky, I'm in a Brisbane area, and I understand that a lot of people in urban areas have far easier access than those in regional. My age and general health status was pretty good before the back pain started 12 years ago, but a lot of other people might have other comorbidities, which is difficult for them. As a general philosophical question, I'd like to ask whether we need more funding actually to address chronic pain. Government funding is important, particularly due to the lack of pain clinics and also in Medicare, and we now have telehealth. Perhaps we need more training for doctors and encouragement to enter the trade, so to speak, and learn what it is to be a pain specialist. I certainly didn't know what one was 12 years ago. And I did allude to this a few minutes ago. I said we need access. Chronic pain patients struggle to get access to timely and affordable allied health, such as physio, acupuncture, hydro, etc. In fact, I'm aware that we have enhanced primary care plans that we can ask for from our GP. I didn't know about these. My GP didn't offer it until I found out and I asked. But it only gives 5 visits a year. So I'd like to ask the question, can we afford to give people more visits per year to do their physio? If it's weekly, it's all over in 5 weeks for physio, and you've got to pay for it for the rest of the year. And not a lot of people can afford that. So fast forward to where I am now, and I'm in a relatively good space. But I'd like to also ask people, or to present to people, some alarming statistics that I've found out in recent times. Some of us may be aware of Associate Professor Malcolm Hogg. He put out a study in 2012 which suggested that persistent pain management services are unable to meet service requirements adequately. He revisited this in 2020, part 2, and he said the range and wait times still remains diverse and extends up to 3 years and beyond in some areas. So it's hard to get in. And advocacy group Pain Australia, they are also saying that there's perhaps only 300 pain management specialists in Australia, yet we have 3.37 million people in chronic pain. And they say we're waiting 12 months to 5 years for public pain clinics to get admission. In fact, the prevalence of chronic pain is estimated to increase to 5.2 million people in the year 2050, which is quite alarming. Looking at the Australian Pain Management Association, or APMA, of which I'm a rank and file member, they say, and this did surprise me, that there's perhaps only one pain specialist for every 21,000 people with chronic pain. And they say that the waiting lists in public hospitals to see a specialist can be 2, 3, 4 years long. By this stage, a lot of patients, such as myself, have already learnt a lot after a few years, and perhaps we know more than we did when we started, but we need this information at the beginning of our journey, in my opinion. Finally, I'd like to talk about Pain Australia's plan, or what has been released by the Australian government on the 21st of May this year, is the National Strategic Action Plan. People can't access pain services. Up to 80%, according to Pain Australia, of people living with chronic pain are missing out on treatment that can improve their health, quality of life, and workforce participation. And it's great that the government is providing $2.5 million towards the early implementation of the plan and allocating $4.3 million to expand pain management services across regional and rural areas. Very important. It looks like a lot of money, $6.8 million, but I believe it's just a drop in the ocean considering the demographics and how this is going to change over time. So in summary, as I said, I'm in a much better space than I was 12 years ago because I've educated myself. My personal pain management plan, or toolkit as it were, is particularly important, not just one thing. I use pain medication, meditation, mindfulness, acceptance and commitment therapy, cognitive behavioral therapy, distraction, and pacing. One of the most important lessons I had to learn was how to say no. I can only do one thing a day for 2 hours, that's it. I practice gratitude daily. I also use medicinal cannabis for the last 18 months, which has been a great opioid sparing tool, I must tell you. That's an entirely different lecture. I use naturopathy, herbs, supplements, heat packs, exercise, diet, giving up alcohol, and I try to observe a regular sleep routine. As I said, learn to say no. Knowledge is power. And I'd like to say, as I mentioned earlier, we all need access to diverse, multimodal or holistic care. It needs to be affordable. Funding for allied health, I've mentioned. I believe we need to expand that. And finally, I'd like to say that we need a system where we have patient-centered care. It needs to be done. There needs to be a debate surrounding holistic treatment. There's no one size fits all, but I hear this so much. Every patient is different. Every patient needs to be heard and needs to be treated individually. Thank you again for the opportunity, and I'll sign off now. Thank you.